destroying America. I mean, they're costing us a damn fortune. If I was a Republican, I'd be screaming about the budget deficits that red states are incurring as a consequence of uninsured people getting COVID and getting sick enough that that they're showing up in the ERs, which raises an interesting question. If you don't believe in medicine so much, you're unwilling to get vaccinated, why are you showing up at the emergency room where they practice medicine? Why not, if you think you might die from COVID, why not, go onto Facebook and log into one of the Facebook groups that told you not to get vaccinated and ask them for advice? That's where you got your initial advice, right? Joan McCarter wrote a great piece over at the Daily Kos. It's titled, "The Unvaccinated Are Breaking Everything: The Bank, the Healthcare System, the Bonds of Society." She's quoting a respiratory therapist at St. Luke's Hospital in Boise, Nancy Roberts. She said, "It's rough. You leave here having worked a very hard shift and trying to take care of people, and not everybody makes it, so it absolutely does wear you down." Roberts goes on to point out that it's bad in Ohio, but as Joe McCarter notes, magnify that several thousand times in Florida or in Texas. And you can, or at Mississippi, where Governor Tate Reeves is like, "Oh, no big deal." And you can get, why some of these doctors, I mean, there was a mini strike by doctors down in Florida yesterday. A radiation oncologist in Tampa, a doctor by the name of Pariani, he says the unvaccinated are killing people in ways they probably never imagined. He tells the story. He says, "I got a call from a hospital that doesn't have a cancer program. These are relatively routine calls. You've got a cancer patient who's gone acute. They have a crisis. You need to get them to a hospital that's got a cancer ward, right?" So he gets this call. And he says the doctor at the outlying hospital had a patient with metastatic brain cancer. She was unable to walk, and without urgent radiation treatment, there was no hope for any meaningful recovery. And then he goes on to say, "We had no beds available. We had paused elective surgeries the previous week because we're trying to control the influx of COVID patients. Our emergency department has a 12-hour delay, wait that day. I had no choice. For the first time in my career, I had to say no." Mississippi is now using paramedics as docs to take care of patients in emergency rooms. Tennessee has deployed the National Guard. They're letting healthcare workers provide care that they're not licensed to give. Here in Oregon, Kate Brown has appealed to FEMA. She's asking them to build a field hospital. We've got the red counties in this state are just wiped out, and they're sending all their surplus patients here into Multnomah County, into the Portland area, because our hospitals are not yet full. We're only at 93% capacity. But our governor, Kate Brown, came right out and said, there may not be a staffed bed for you if you have a medical emergency. In other words, because of the COVIDiots, because of these people who are refusing to get vaccinated, if you have a heart attack, you may well die without seeing a doctor. If you have a stroke, you may end up paralyzed for the rest of your life without seeing a doctor. If you get in a car accident and you have broken bones or you're starting to bleed out, you may die or end up with a life-changing injury without being able to see a doctor, in a timely fashion that could save your life. This is just amazing. Tiffany Murdoch, a hospital administrator for the Singing River Health System in coastal Mississippi, quote, "The hospitalizations and deaths are from the Delta variant, and they're absolutely overwhelming from vaccine refusers. We've had, that's a quote from Joan McCarter. Now is Tiffany. Quote, "We've had 44-year-olds, 45, 35-year-olds that have died. I've been a nurse for 15 years, and I've never seen anything like it." She talked about a husband and wife who were in their 40s, both unvaccinated. They both just died. She said, "We've had 5 people die, like room after room after room, just on Friday." This is a quote from last week. And what's this costing us? Well, according to the Kaiser Family Fund, they did an analysis, and they said that just the last 2 months have cost America $2 billion just caring for unvaccinated people. For the Trump holes, the COVIDiots, the whatever you want to call them. The Centers for Disease Control and Prevention estimates that 37,000 preventable hospitalizations have occurred because people are not vaccinated for COVID. And that was just in June. There's 76,000 in July, and here we are in August. They haven't compiled the statistics for this month yet. Those will come out in the next week. But last month, it went from 37,000 in June, unnecessary hospitalizations because people aren't vaccinated, from 37,000 in June to 76,000 in July. I'm guessing it's going to be 150,000, 200,000 this year. And somebody has to pay for that. Dora Rubinstein-Rice, an expert on vaccine policy at UC Hastings College of Law, says people who don't vaccinate are imposing costs on the community that they're not paying for. She says, you know, it's like companies that pollute and don't cover the costs. Should we be charging unvaccinated people more? Well, the tragedy is, particularly in states like Florida and Mississippi and Texas that have not expanded Medicaid, is that not only are many of these folks, these Fox News watchers and these Trump humpers, not only are they unvaccinated, they're also uninsured. And they don't even have access to Medicaid because their Republican governors refuse to expand Medicaid in their states. And so who's paying the bill? You and me. These are the states that for every dollar they send to Washington, D.C., they get back $2 or $2.50 or $3 back. Now they're going to be getting $4 and $5 back because we're paying for their ER costs. Enough. It's time for freedom passports or right to life passports or whatever the hell you want to call them. It's time for Americans who you know, the vast majority of us who took the rational steps to stand up and say, enough.